Good evening, everyone. Welcome to our lab CAA assessment for the Basic Anatomy and Physiology module, week 4. And we shall take up the nervous system together with the Back-Shu points. Let's call on Ma'am Angel po. Good evening, Ma'am Angel. Are we ready?
Good evening po, Doc Hector. Good evening, classmates.
Number 1 is pointing to...
Number 1 is pointing to the brachial plexus.
Good. The cerebrum is indicated by number.
Number 6 po, Doc.
Number 7 is pointing to...
The cerebellum po.
The ulnar nerve is indicated by number.
Number 5 po.
Great. Number 8 is
Number
pointing to...
To spinal cord po, Doc.
The musculocutaneous nerve is indicated by number.
Number 2 po.
Number 3 is pointing to...
The radial nerve.
The cerebellum is indicated by number.
Number 7, Doc.
The median nerve is indicated by number.
Number 4.
Number 5 is pointing to...
Number 5 is pointing to the ulnar nerve.
Number 2 is pointing to...
The musculocutaneous nerve.
The radial nerve is indicated by what number?
Number 3.
Number 6 is...
Number 6, pointing to the cerebrum.
Number 4 is pointing to...
The median nerve.
The brachial plexus is indicated by number.
Number 1.
Number 10 is pointing to...
The subcostal nerve.
The obturator nerve is indicated by number.
Number 13.
The spinal cord is indicated by number.
Number 8.
The common peroneal nerve is indicated by number.
14 po.
The intercostal nerves are indicated by number.
Number 9.
Number 15 is pointing to...
The deep peroneal nerve.
The genitofemoral nerve is indicated by number.
Number 12 po.
The subcostal nerve is indicated by number.
Number 10 po.
The iliohypogastric nerve is indicated by number.
Number 11 po.
Number 12 is pointing to...
Genitofemoral nerve po.
Number 9 is pointing to...
The intercostal nerves.
The deep peroneal nerve is indicated by number.
Number 15 po.
Number 11 is pointing to...
To the iliohypogastric nerve.
Number 13 is pointing to...
The obturator nerve.
Obturator nerve.
Obturator nerve.
The number 14 is pointing to...
The common peroneal nerve.
Number 19 is pointing to...
The femoral nerve po.
Number 16 is pointing to...
The superficial peroneal nerve.
Tibial nerve is indicated by what number?
Number 24 po.
Number 18 is pointing to...
The sacral plexus.
Now, the sciatic nerve is indicated by number.
Number 21.
Number 17 is pointing to...
The lumbar plexus.
The pudendal nerve is indicated by number.
Number 20.
Number 21 is pointing to...
The sciatica nerve.
The sacral plexus is indicated by number.
Number 18 po.
The saphenous nerve is indicated by number.
Number 23.
The femoral nerve is indicated by number.
Number 19.
Number 20 is pointing to...
The pudendal nerve.
Lumbar plexus is indicated by number.
Number 17 po.
Number 22 is pointing to...
The muscular branches of the femoral nerve.
The superficial peroneal nerve is indicated by number.
Number 16.
Okay, congratulations.
Thank you po, Doc.
Angel, excellent job. Thank you po. No mistake. Wow. Next, we call on Ma'am Ami Glorioso.
Hello, Doc. Good evening, classmate. Good evening po.
What is a synapse?
A connection between the neuron and another cell.
What is one distinguishing feature of nerve impulses?
They travel quickly around the body.
Which structures form the central nervous system?
Comprises Structure comprises of the brain and the spinal cord.
Which type of signal is transmitted in a neuron?
Electrical.
In what order do nerve impulses travel through the parts of a neuron?
It dendrite, cell body, and axon.
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 Which stimulus would incite a withdrawal reflex?
By touching a hot iron.
Which of these is not a reflex action?
Breathing.
Which of the following structures is not part of the reflex arc?
The brain.
Which chemicals are used to communicate between synapses?
Neurotransmitters.
Which system would the body use in reaction to a pain stimulus?
Reflect arc.
What is the correct sequence of events in a reflex?
Stimulus, sensory, neuron, motor neuron,
Action.
action.
So stimulus, sensory neuron, motor neuron, action. The medulla oblongata is continuous with which structure?
The spinal cord.
Which part of a neuron does the myelin sheath cover?
Action.
Axon.
Axon.
Which bony structure protects the spinal cord from damage?
The spinal column.
Which structure regulates the heartbeat?
Medulla.
What is a nerve?
A nerve is a group of neurons in the central nervous system.
No. One mistake. A bundle of axons. Do you want to try?
In the central nervous system.
Dalawa na lang. What is the correct answer there?
A group of neurons.
No, it's wrong. It's not a group
A
of...
bundle of action in the central nervous system.
No. Peripheral nervous system.
Okay.
A bundle of... So a nerve is a bundle of axons in the peripheral nervous system.
Okay.
How do neurons communicate with each other?
Via synapses.
What is the function of the myelin sheath?
Protections and insulations of neuron axons.
So now you would understand what happens when you have multiple sclerosis, okay? Where would a Schwann cell be found?
Okay, doc. Peripheral nervous system.
What is the basic functional role of the cerebellum?
Motor activity.
Which of the following does not protect the brain from damage?
The immunoglobulins.
Where are dendrites located on a neuron?
From the cell body.
Branched from the cell body.
Branch from the cell body.
What is the name of the electrical signal in the neuron?
Is an action potential.
What fluid surrounds the brain to protect it?
Cerebrospinal fluid.
Yeah, this is what we shorten as CSF, okay? What best describes the all or none principle?
Neuro that reacts to the signal must react completely.
The hypothalamus connects which two systems?
The nervous and the endocrine system.
What gives white matter in the brain its color?
Myelinated axon.
Which of these is an excitatory neurotransmitter in skeletal muscle?
Acetylcholine.
The internal organs are controlled by which nervous system?
Autonomic nervous system.
Which of the following is a symptom of multiple sclerosis?
A loss of the myelin sheath around neurons.
Number 13 indicates?
Number 13 indicates pituitary gland.
Pituitary gland. The midbrain is
Pituitary
indicated by number.
number 12,
What is number 14 pointing to?
optic nerve.
Which number is pointing to the pineal gland?
Number 1,
Number 2 indicates the
thalamus.
hypothalamus is indicated by number.
4,
What is number 9 pointing to?
spinal cord.
Which number is pointing to the cerebrum?
Number 3,
Number 6 indicates
corpus callosum.
corpus callosum. Okay. The medulla oblongata is indicated by number.
Number 10,
What is number 7 pointing to?
cerebellum.
Which number is pointing to the lateral ventricle?
Number 5,
Number 11 indicates
the pons.
the parts of the brain labeled 2 and 4 are together called
The encephalon.
diencephalon. Okay. What is number 8 pointing to?
Fourth ventricle.
Good job, Ma'am Ami.
Okay, thank you, Doc.
Congratulations. Let's
Thank you
call on Ma'am SP who looks so ready. Perfect po bawal magkamali. Okay, go. Number 8 is pointing to.
The occipital lobe,
Great. What is number 11 pointing to?
the temporal lobe,
Okay, expert na kayo dito because I think you are performing scalp, right? Under
Yes.
Dr. Gavino. Okay. The primary visual area is indicated by number.
7,
Number 4 is pointing to.
the primary motor area,
Which number indicates the premotor area?
5,
What is number 2 pointing to?
the primary somatosensory area,
The primary auditory area is indicated by number.
10,
Number 15 is pointing to.
the prefrontal cortex,
Which number indicates the lateral cerebral sulcus?
number 14,
What is number 13 pointing to?
the Broca's area,
Which number indicates the frontal lobe?
number 6,
Number 12 is pointing to.
the primary gustatory area,
Wernicke's area is indicated by number.
9,
What is number 1 pointing to?
the parietal lobe,
The central sulcus is indicated by number.
3,
Wow. Okay. What does B indicate?
the median plane,
The median plane divides the body into.
left and right halves,
Plane A is.
the coronal plane,
The coronal plane divides the body into which of the following?
the anterior and posterior portions.
Which letter indicates the sagittal plane?
Letter C,
Which letter indicates horizontal or transverse plane?
letter D,
A horizontal plane divides the body into which of the following?
superior and inferior portions.
In the international anatomical position, the feet are together and the palms of the hands stay.
The anterior D,
An area of the body given to the front, shown as direction C in the image, is referred to as.
anterior.
An area of the body further from the median plane, shown as direction D on the image, is referred to as.
Lateral,
Which of the following is lateral to the eye?
the ear.
An area of the body closer to the median plane, shown as direction E on the image, is referred to as.
Medial,
Something closer to the feet, shown as direction F on the image, is referred to as.
inferior,
Which of the following is inferior to the left elbow?
the left hand.
An area of the body nearer to the back, shown as in the image, it's referred to as.
Posterior,
What does E indicate in the image?
the colonal plane of the feet.
What is the anatomical name for the sole of the feet?
The plantar surface.
Which of the following describes the position of point 1 in comparison with point 2?
Point 1 is medial.
Compared to point 2, point 2 is.
Proximal,
Which surface of the hand is shown by point 3?
dorsal surface.
Something closer to the
Something
hip
closer
on
to
the
the
direction A on the
direction A
image
on the
compared to us.
to us.
Superior.
Compared to point
Compared to
4 is.
4 is.
Superior.
Compared to point 4,
Compared to point 4
is.
is.
Distal.
A sagittal
A
plane
sagittal
runs
plane
parallel to.
The medial plane.
The toes are anterior to the ankle. True or false?
True.
The median plane passes through the body at right angles to.
Horizontal and coronal planes.
Which of the following terms refers to the inferior end of the vertebral column?
Caudal.
The two areas located at the same side of the body, left or right, are said to be.
Ipsilateral.
The elbow is proximal to the wrist. True or false?
True.
The two areas located on opposite sides of the body are said to be.
Contralateral.
Wow, perfect. Congratulations, Ma'am SP. I'm
Thank you,
very
sir.
proud of you. Wow. Congratulations. Keep up the good work. Next, let's call on Sir June Asariel. So ready?
Yes, Doc.
Okay, bawal magkamali ah. And a doctor. What's your
Doc,
answer?
medyo maingat. Move a limb towards the midline.
Okay. What is the name for a muscle that turns a limb to face downward?
The pronator, Doc.
A flexor.
Decrease the angle at a joint.
From the anatomical position, turning the palm to face the body is an example of.
Medial rotation.
Lifting the shoulders towards the ears is an example of.
Elevation.
What do we call a muscle that moves a limb away from the midline?
Abductor, Doc.
AB or A dog?
Abductor.
Okay,
AB.
AB. Pulling the jaw back is an example of.
Retraction, Doc.
Retrusion.
Sorry.
Retrusion yan. Retrusion. Opposite ng protrusion. Retrusion. What do we
Retrusion.
call a muscle that increase the angle at the joint?
Extensor, Doc.
A supinator, what?
Turn a limb to a face upward.
Very good. Flexing the foot at the ankle is called.
Plantar flexion, Doc.
No. Flexing the foot.
Inversion, Doc. Aray.
Huh?
Inversion po, Doc.
No. Flexing the foot
Dorsiflexion,
na
Doc.
eh. Papunta.
Dorsiflexion po.
Dorsiflexion. Okay. What is the anatomical name for pushing down the shoulders?
Depression, Doc.
Pushing the jaw forwards is an example of.
Protrusion.
Extending the foot at the ankle is called.
Circular movement po, Doc.
Wala nang circular movement dyan.
Sorry po.
Ano ba yan? Yung kanina, flexing the foot at the ankle. Ito naman, extending the foot at the ankle is called.
Flexing po is plantar flexion po.
Okay. Circumduction of a limb means moving it in which of the following ways?
Okay.
What's your answer?
Circular movement po, Doc.
Circular movements. Turning the foot outwardly from the body at the hip is an example of.
Lateral rotation po.
Very good. How many types of joint are there in the human body by structural classification?
3 po, Doc.
No.
Hello.
4 or 5?
5 po.
4. ba yan?
Ay, 4.
Di mo ni-research. 4. Which type of joints are freely movable?
The synovial joint po.
How many major types of synovial joint are there?
3 po.
No.
1.
So 8 or 6?
6 po, Doc.
6. The atlantoaxial joint, which is label A, or atlantoaxial joint, is what type of joint?
Pivot.
Okay, pivot joint or pivot joint, pivot joint.
Pivot.
The elbow joint is an example of,
Ano to? Hinge joint or?
yes, hinge
Doc?
joint. The sutures between the bones of the skull are an example of
Fibrous joint.
which type of synovial joint are the carpometacarpal joints labeled C in the image?
Sandal joints.
Saddle joints. Which of the
Saddle.
following is an example of a synovial plane joint shown in the image above?
Letter D po, acromioclavicular joints. po.
Good. What sort of synovial joint is the hip joint? The acetabulofemoral joint, label E in the image.
Ball and the socket joints.
Yeah,
po.
ball and socket joint. Which type of joints are held together by hyaline cartilage or fibrocartilage?
Cartilaginous
Cartilaginous.
joints. po.
Cartilaginous joints. The
Right.
metatarsophalangeal joints, label F in the image, are which type of synovial joint?
Condyloid joints.
Okay,
po.
condyloid joints. Which type of joint sits within an articular capsule?
Synovial joints. po.
The proximal and distal radioulnar joints are examples of
Pivot
Yeah.
joints.
which type of synovial joints are those between the carpals of the wrist?
Plane joints. po.
The radiocarpal joint, which is the meeting of the forearm with the wrist, is what type of joint?
Condyloid joint. po.
Okay, condyloid joint. The image above shows what?
Synovial joint. po.
What is contained within the joint cavity of a synovial joint, which is number 2 in the image? This is very important. Maraming ganyang pasyente, ha?
The synovial fluid po.
Okay. The knee joint is a compound of 2 synovial joint types. What are they?
Saddle and a hitch joints po.
No. Condyloid. Condyloid and saddle joint. What is number 4 in the image?
Articular cartilage po.
Which type of joints allows growth in long bones during childhood?
Primary cartilaginous joint.
Cartilaginous joints. Good. In the image, what number indicates the synovial membrane?
1.
The intervertebral discs between the vertebrae of the spine are a type of
Synovial plane joint po.
no, secondary cartilaginous joint. What is number 3 in the image?
Articular capsule. po.
No.
Mali na naman.
Cartilage.
Car-
So
Cartilage
capsule
po.
na. Fibrous capsule or articular capsule?
Capsule.
Articular capsule po.
Sino mo mabuti yung quality ng number 3?
Articular
Okay.
cartilage po.
Fibrous capsule. Fibrous yan eh. Tingnan mo mabuti. Can you not see?
Okay.
Due to its very loose joint capsule, the most mobile joint of the human body is
Luminal joint po.
glenohumeral joint. Where is it? Can you point it to us? Where is it? Ituro mo sa amin. Para malaga.
Wait lang po, Dok. Hindi inaano
Nasaan
ko
si
yung-
glenohumeral joint? Naku,
Number-
ano yan?
Mahirap naman. Dali.
Nasaan si glenoid fossa? Si
Nasa number,
saan?
nasa number 3 po.
So, ituro mo. Andyan lang sa upper part ng body mo. Turo mo na saan siya. Take note, the most mobile joint, ang pinaka-movable. Glenohumeral joint, right? Or glenohumeral joint. Ito,
Dito po.
nagagalaw-galaw mo yan. Numbers 1 and 3 in the image together are called,
Synovial capsule po.
no,
Particular capsule.
articular capsule.
Articular capsule.
Which
Very
type
might-
of joint is held together by dense connective tissue, mainly collagen?
Fibrous.
Fibrous
Fibrous
joint po.
joints. Which type of synovial joint is the sternoclavicular joint?
Saddle joint po.
Saddle joint. The synovial joints between the metatarsals of the foot are what type of joints?
Condyloid joint po.
Okay. The fibrous joint between the ulna and the radius, which allows slight movement, is an example of
Tendinosis.
syndesmosis. The
Tendinosis.
pubic symphysis is a type of
Second cartilagian joints po.
secondary cartilaginous joint. Good work, Sir June. Study more.
Thank you,
Okay,
Doc.
let's go to Sir Darwin. Sir Darwin Misola, good evening. Are you ready? Yeah,
Good
very
evening po.
ready.
Good evening po.
What connects muscle to bone?
Tendons,
How many bones are there in the hand and wrist?
27.
The longest bone in the body?
The humerus.
No. Sigurado. Compare mo yung femur mo sa humerus. Mas mahaba. What's your answer?
Sa femur.
Femur. One mistake. Which bone is the only one that's not connected to another?
Hyoid. Hyoid.
The largest organ in the human body.
The skin.
How many bones are there in the human foot?
26.
Red and white blood cells are formed in the
Bone marrow.
calcium is a major component of
The bone.
the study of bones is called
Osteology.
the smallest bone in the human body.
Stapes.
A band of fibrous connective tissue connecting one bone to another is called
Ligaments.
tendons are made of
Elastic tissues.
cartilage is
Protective covering on the surface of the bones.
which joints are highly movable?
Synovial joints.
A ball and socket joint is which type of joint?
Synovial joints.
What is the name of the fibrous protein found in hair and nails?
Keratin.
Wait, medyo maingay yung iba. Wait lang ah.
Ilalaman nito sa una.
Yan. What is the name? Okay. Yeah, what's your answer?
Keratin. Doc.
Good. The hip joint is an example of
Ball and socket.
an adult human skeleton accounts for what percentage of their body weight?
14%.
Approximately how many times does an average human breathe in one day?
23,000.
The total number of cells in the human body is approximately
10 to 50 trillion.
great. Which of the following is one of the most commonly fractured bones of the body?
The clavicle.
Which grows fastest, the facial head or pubic hair?
Facial hair.
Which of the following is the anatomical name for the collarbone?
Clavicle.
Which of the following is the largest internal organ?
The stomach.
No, ang laki-lit ng stomach. Gagawin ko sa kasama, pinalaki mo yung stomach.
The large intestine.
No. The largest.
Liver.
Walang liver dyan.
Oo nga eh.
So
Small
wala na,
intestine.
mali ang stomach, mali ang
small
large intestine. The answer is a small
small
intestine.
intestine.
Where would you find the uvula?
At the top of the throat.
The sac which surrounds the heart is known as?
Pericardium.
What is the anatomical term for the area of the nose that separates the nostrils?
Septum.
What is the correct anatomical name for the tailbone?
Coccyx.
Which is the larger bone in the lower leg, the tibia or the fibula?
Tibia.
What is the scientific term for fatty tissue in the body?
Adipose tissues.
What is the name of the bone that forms the lower jaw?
Mandible.
What is a normal human body temperature?
37.5 to
Oy,
or
normal.
36.5 to 37.5.
Okay. In which part of the body would you find the incus and stapes bones?
In the ear.
Where in the body is the basilar artery located?
The brain.
Approximately how many times per minute does an average human blink?
25.
No, grabe, ang dami naman. No.
5.
No, too slow. 15 times. Research, 15 times. The metatarsal bones are in which part of the human body?
The foot.
How long is a typical adult human esophagus?
25 cm.
Okay, or 10 inches. What is the largest muscle in the buttocks?
Gluteus maximus.
What is the name of the endocrine gland in the throat?
Thyroid gland.
If laid end to end, the total length of all the blood vessels in a typical adult human would measure approximately
97,000 kilometers.
Wow, you see? What is the name of the fibrous connective tissue that connects one bone to another?
Ligaments.
What does the word cephalic refer to?
Head.
What does the pigment melanin determine in the body?
Color of the skin.
Which part of the small intestine do the bile and pancreatic ducts enter?
Duodenum.
The smallest type of blood vessels are called?
Capillaries.
Congratulations, Sir Darwin. Next time, don't commit a mistake, okay? You have to read the question very well. Thank you.
Thank you.
Good job. Let's call on Sir Elvis Blones. Good evening, Sir Elvis. Sir Elvis? Yeah, okay. Is your mic okay? Ay, bakit walang sound? Paano yan? Okay. Yan. Okay, may sound na.
Ay, akala ko.
Number 6 is pointing to... Ay, bakit wala pa rin?
Doc, sa akin po. Doc, ako po ba yan?
Hindi. Bakit walang boses si Sir Elvis? I think may problema yung ano mo. Ganito na lang. There are 3 options. One finger is the first one. Pag dalawa, letter B. Letter C ang ano, ikatlo, ha? What happened to your mic? Okay, number 6 is pointing to... Okay. Diyos ko, para tayong ano nito. The nucleus is indicated by number. Sino ba marunong ng sign language? Okay. Which number is pointing to the nuclear membrane? Okay. A vacuole is indicated by number? No. Where is the vacuole there? Ano ba yan? Bakit tayo bingi? No! It's 2. Okay. 15. What is number 3 pointing to? What's your answer? Kaakala. What is indicated by number 14? Okay. What is number 1 pointing to? Okay. Which number is pointing to the smooth endoplasmic reticulum? DNA is found within? Oops, no. No. Wrong answer. Yeah, okay. You have 2 mistakes. A microfilament is indicated by number. What is indicated by number 5? What is number 4 pointing to? Number 7 is pointing to. The rough endoplasmic reticulum is indicated by number. Which number is pointing to a centriole? What is indicated by number 9? The plasma membrane is indicated by number. Number 10 is pointing to. Which number is pointing to a ribosome? Number 12 is pointing to. What's your answer? Okay. The cytoplasm is indicated by number. Don't get confused. Okay. What is number 13 pointing to? Which number is pointing to the nucleolus? No. Okay. Number 1. What is number? So ito po is number 10, ha? Number 10, the first one, the first choice. What is number 15 pointing to? No. Ay, mali din. 2. The vacuoles. The Golgi complex is indicated by number. What is indicated by number 11? Okay. A lysosome is indicated by number. Okay. What is indicated by number 8? Human cells are which kind of cell? Number 2 is pointing to. Okay. Label 2 indicates. Okay. Which label indicates the dermis? What is number 6? The stratum corneum is indicated by label. Label 11 indicates. Okay. Which label indicates a hair follicle? What is number 5? The sebaceous gland is indicated by label. Label 1 indicates. Which label indicates the stratum granulosum? What is number 8? The stratum spinosum is indicated by label. Label 15 indicates. Which label indicates the erector pili muscle? What is number 3? Meissner's corpuscle. Okay. Thank you very much, Sir Elvis. Paki-check mo naman yung audio mo. Diyos ko. Yeah. Okay. Thank you. Next, let's call on Sir Victor Ginto Jr. Good evening, sir.
Good evening, everyone.
Okay. Which layer of the skin does not contain blood vessels?
Epidermis,
In which layer of the skin are melanocytes located?
epidermis
What is the function of an adipocyte?
for fat storage,
Which of these body parts does not contain melanin?
nails
What is the function of a pore?
to secrete sweat,
What is a sebum?
an oily substance secreted on hair,
Sweat glands are located in
dermis,
what type of tissue is the main component of the dermis?
connective tissue,
Where are hair roots located within the skin?
dermis,
What substance are nails made of?
keratin,
Which condition is caused by lack of melanin synthesis?
albinism,
Where on the body does hair not grow?
palms of the hands,
Which is not part of the connective tissue in the dermis?
keratinocytes,
Which of these is not a function of hair?
to secrete sweat,
What can trigger vitamin D synthesis?
exposure to sunlight,
Which type of layer separates the epidermis from the dermis?
basement membrane,
How does the epidermis absorb oxygen?
by diffusion with the surrounding air,
What type of cell provides the physical barrier of the skin?
keratinocytes,
What type of epithelium is the epidermis composed of?
stratified squamous epithelium,
Which of the following is not a type of adipose tissue?
black adipose tissue,
What is the function of melanin?
to protect DNA in cells from UV radiation,
Sebum is secreted from?
the sebaceous gland,
What is alopecia?
hair loss,
What are the immune cells in the epidermis called?
Langerhans cells,
Which organ produces hair?
the hair follicle,
What is the function of the connective tissue in the dermis?
give flexibility to the skin,
UVB radiation damage can cause which of the following?
malignant melanoma,
What is the function of piloerection?
to trap warm air between hairs,
What is the function of the erector pili muscle?
to make hairs stand on end,
What is cornification?
keratinocytes forming a physical barrier,
Label number 1 in the diagram indicates which part of the bone.
metaphysis,
The bone on the left in the image is the
femur,
label number 5 in the diagram indicates.
diaphysis,
What do we mean by an articulation?
an area where bones contact each other,
A crest on a bone is.
prominent ridge,
What is label number 4 pointing to in the diagram?
proximal epiphysis,
What is a condyle?
large rounded articular process,
A canal is.
a long tunnel-like opening within the bone,
Label number 3 in the diagram is pointing to.
distal epiphysis,
The bone on the right in the image is the.
humerus,
An articular process is.
a projection that touches an adjacent bone,
In the diagram, what is label number 2 pointing to?
medullary cavity,
A small projection or bump is known as.
eminence,
What is the name for a projection near to a condyle?
an epicondyle,
A small flattened articular surface is called.
facet.
Okay, congratulations. Perfect, Sir Victor. More power.
Salamat po.
O di ba repetition lang to hanggang sa masanay na kayo pa ulit-ulit. Ha? So don't complain kung maraming question. Hanggang sa, maiukit na yan sa mga utak natin. Maraming salamat po, Sir Victor. Good, excellent job.
Salamat po.
Let's go to Baguio, Ma'am Janine.
Yes, good evening.
Good evening. In the diagram, the diaphysis is indicated by label number.
5.
A projection that contacts an adjacent bone is called.
Articular process.
Adjacent bones contact each other at.
An articulation.
In the diagram, the metaphysis is indicated by label number.
1.
A long tunnel-like passage is called.
A canal.
What do we call a large, rounded articular process?
A condyle.
Which label in the diagram indicates the medullary cavity?
Number 2.
An eminence is.
A small projection or bump.
The term epicondyle refers to.
A projection near to a condyle.
In the diagram, the distal epiphysis is indicated by label number.
Number 3.
A prominent bony ridge is called.
A crest.
A facet is.
A small flattened articular surface.
Which label in the diagram indicates the proximal epiphysis?
4.
What is a foramen or foramen?
An opening within a bone.
A fossa is.
A wide and shallow depression.
The term fovea refers to.
A small pit or depression.
A labyrinth is.
A cavity within a bone.
The line on the bone is called.
A long thin projection or ridge.
A malleolus is.
A protuberance of bone in the ankle.
The term meatus refers to.
A short canal open at one end.
A large projection or bump is known as.
A process.
A small projection or bump is known as.
Process, Doc? Wrong? Foramen.
No. Your
Ano,
answer is correct. Large projection or bump is a process.
Yes, process,
The
di ba,
next
Doc?
question is a bonus question. A small protuberance.
Small. I don't know. I forgot.
You should not
An
forget.
eminence. Tama ba, Doc?
Oh, di ba? Paulit.
Tama.
This is a
Naalala ko.
review.
Yes, Doc. Eminence. Okay.
You know, you should pumuntahan ng kumuha ka ng mga buto-buto dyan. A branch from a bone is called.
Ramus.
A cavity within a cranial bone is.
Sinus.
A long thin projection on. Okay, let's talk about sinusitis.
Okay, Doc.
Why is it called sinusitis?
It's in the sinus.
Inflammation of the sinuses. Saan siya? Saan siya located? Okay.
Dito,
So
Doc.
anyway, this is not part of. Eventually, you will get to know them. Okay, a long thin projection on the bone is sometimes called.
Spine.
The articulation between two cranial bones is called.
A suture.
A trochanter is.
A tuberosity on the femur.
The term tubercle refers to.
A small rough projection or bump.
What is a tuberosity?
A rough projection or bump.
What is the smaller version called?
A smaller bump. I don't remember. I have to look back in my
The
notebook.
tubercle. The epiphysis is.
An area of hyaline cartilage between the epiphysis and the metaphysis.
Are you
Metaphysis.
sure? Does anybody have another answer? Sir June,
Diaphysis.
confused ka na sa diaphysis.
The
What's
shaft.
your answer, Sir Darwin?
Shaft of long bone.
Shaft.
Shaft of long bone.
Oh my God, this is repetition na ha. This was last week.
Oo nga, Doc. Hindi ko siguro nakuha yung answer doon.
What is an epiphysis?
Oo nga pala. A shaft of a long bone. Sorry.
So, epiphysis, diaphysis.
Yes.
A small pit found on the head of a bone is called.
Oh, fovea.
A cavity within the bone is sometimes called a.
Labyrinth.
A long thin projection on the bone is sometimes called.
A line.
Which of the following is a protuberance in the ankle?
Malleolus.
A short
Malleolus.
canal in the bone open at only one end is called.
Meatus.
A process is.
A fairly large bony projection.
What is a ramus?
An arm-like branch of a bone.
The term sinus refers to.
A cavity within a cranial bone.
A spine on a bone is.
A long, thin projection or bump.
What is a suture?
An articulation between the cranial bones.
An epiphyseal plate is.
An area of hyaline cartilage between the epiphysis and the meta.
Okay, you Google this. You should know how this looks like. The head of a bone is.
The proximal articular end.
What is a metaphysis?
The area of a long bone between the epiphysis and the diaphysis.
The neck of a bone is.
The area between the head and the shaft.
An opening through a bone is known as.
Foramen.
Okay. Thank you very much, Janine. Please
Thank you,
always remember to go back to your old notes. Okay?
Yes,
Make this exercise very effective. Otherwise, everything would be futile para tayo nagko-compete ng ano. Paulit-ulit lang po ito, ha? Okay? So I hope that helped. Congratulations. Good job, Ma'am Janine. More effort next time. Now, let's call on Ma'am Cheryl Bahamundi. Good evening.
Good evening po.
A broad shallow depression is called.
A fossa.
Which of the following is a tuberosity on the femur?
The trochanter.
A smaller projection than a tuberosity is sometimes called a.
A tubercle.
Okay, this was my question earlier, Ma'am Janine. Okay, which is bigger, tuberosity or tubercle?
The tuberosity.
Rough projection of bone is known as.
A tuberosity.
The main shaft of a long bone is called.
The diaphysis.
The end region of a long bone
is the epiphysis.
The area of hyaline cartilage between the epiphysis and metaphysis is.
Is the epiphyseal plate.
The proximal articular end of a long bone is known as.
Is the head.
The area of a long bone between the epiphysis and the diaphysis is called the.
Metaphysis.
The area between the head and shaft of a long bone is called.
The neck.
What do we mean by articulation?
An area where bones connect or contact each other.
A canal is.
A long tunnel-like opening within a bone.
A prominent bony ridge is called a.
A crest.
A not so prominent bony ridge is called.
Is your eminence.
Yes, okay. Okay, here it is. An eminence is.
Okay, a small projection or a bump.
Okay. Okay, if you have access to some medical schools, no, you just ask permission. Especially, ay, ano ba ngayon? Oh, yeah. Yeah, so mga, they have bones there. Look at the bone, identify the parts, no? Okay, I hope you're enjoying this. Yeah, the term epicondyle refers to.
A projection near a condyle.
Okay, let's go to the anatomy of the muscle. Okay, number 9 is point 2.
Is that the perimysium?
A muscle's elasticity is ability to.
Return to its original length when.
After contraction. What does number 6 indicate?
That's your tendon.
An adductor is a skeletal muscle which.
Will move a limb toward the midline.
What does number 8 indicate?
That's a fascicle.
Which number indicates an example of cardiac muscle?
I think it's 12.
Which type of muscle is stimulated by nerve impulses from the brain and spinal cord?
The skeletal muscle.
Which number indicates the main skeletal muscle?
Number 2.
skeletal muscle is attached to bones by?
Tendons.
Which number indicates an example of skeletal muscle?
I think that's 10.
Where on the body would you find the trapezius?
At the upper back,
The muscle around the eyes is called the
orbicularis oculi.
main muscle involved with chewing.
Masseter.
How many main types of muscle tissue are there?
3.
What are they?
The smooth, the skeletal, and the cardiac muscles.
Which type of muscle is also known as voluntary muscle?
Skeletal muscles.
Number 11 is pointing to an image of
The smooth muscle.
periosteum is indicated by number.
1.
Which number indicates the epimysium?
Number 3.
A muscle fiber is indicated by number.
4.
What is the name of the large muscle at the back of the calf?
The gastrocnemius.
Which of the following muscles turns the head?
The sternocleidomastoid.
A muscle's contractility is its ability to.
To contract forcefully when stimulated.
What does number 5 indicate?
It's a myofibril.
Which of the following muscles acts as an antagonist to the biceps brachii?
The triceps brachii.
Which type of muscle is sometimes called involuntary muscle?
The smooth muscle.
The outer layer of connective tissue which surrounds skeletal muscle tissue is called.
Is the epimysium.
Which type of involuntary muscle has branched striated fibers?
The cardiac muscle.
Number 7 is pointing to.
The endomysium.
Which type of muscle tissue is found in blood vessels?
Smooth muscles.
A muscle's extensibility is its ability to.
A stretch without being damaged.
Thank you very much, Ma'am Cheryl. Excellent
Yay!
job.
I'm done. Thank you, Doc.
Thank you. I hope you're enjoying this. May mag-aaral kayo ha next time, yung ano na ba tayo, cardiovascular, quite easy. So we'd like you to be very familiar with the pathology as well, because we hope that we can align ourselves with the medical people in the future. And I think that's what you wanted, right?
Yes.
So that they will recognize us, and at least you should know what, you should know a lot about cardiovascular. Okay, thank you very much. Congratulations. Let's call on Sir Michael R. Rivera. Sir Michael.
Hello, Doc. Good evening, classmate.
Good evening. Wow, you look. So next week, I want you to come early para mabilis ka puro cardiovascular. Okay, let's go. How many main types of muscle tissue are there?
3, Doc.
A muscle's elasticity is its ability to.
Return to its original length after contractions.
Which number indicates the epimysium?
Is number 3.
An adductor is a skeletal muscle which.
Plexus of muscles.
No. Adductor. Adductor, double D.
A move.
Towards the midline, away from the midline. Kasi mali na yung flexes sa muscle eh.
Move. Move a limb away.
Oh no!
Ano siya? Move switch towards the midline, sorry. Abduction up. Abduct. Maybe.
Are you sure?
Move limb towards the midline.
Okay. Which number indicates an example of cardiac muscle?
Number 12.
The outer layer of connective tissue which surrounds skeletal muscle tissue is called?
Epimysium.
Which number indicates the main skeletal muscle?
Is number 2.
Which number indicates an example of skeletal muscle?
Number 10.
Number 11 is pointing to an image of?
Smooth muscle.
Muscle around the eye is called?
Orbicularis oculi.
The main muscle involved with chewing.
Masseter.
Which type of muscle is known also as voluntary muscle?
I call it skeletal muscle.
A muscle's contractility is the ability to
contract forcefully when stimulated.
What is the name of the large muscle at the back of the calf?
Gastrocnemius,
Which of the following muscles acts as antagonist to the biceps brachii?
tricep bicep brachii.
What is the action of the biceps brachii?
Ano, some question yun, Doc?
What is the action of the biceps brachii? Ay, ano ba yan? Dapat alam mo yan. So, you say antagonist, iba yung effect ni triceps, right? So,
What's that?
what
The
does
action.
No. One flexes, the other one extends. So what does it flex? Wait, where is the biceps brachii? Can you show us? Do you have it? No, wrong. That's not biceps. Okay. Nasa anti-triceps brachii. Are you sure? Where is the biceps brachii? So what does the biceps brachii do?
Stretch. Wala na ako dun.
Ano ba yung piniflex parati ng mga nag-gym?
Yung back of the muscle. Here, somewhere here.
Sige, pagpunta ka ng gym. Naku, what reference are you using?
Just everything, Doc, internet, books.
Did you review what we have taken up last time? I think we have the picture of the biceps there with so many muscles. I think paulit-ulit natin yung muscle hanggang sa mag-sink in. Okay. Let's go to the next. Let's go to the anatomical word root. What does the suffix logist, as an oncologist, means?
Someone who studies a certain field.
Which of the following prefixes means away?
As in abduction.
A boy or a dog?
AB. As
a boy.
AB.
The suffix tomy, as in gastrotomy, means?
Of cutting incisions.
The prefix for through, during, or across is?
Is as in dialysis.
What does the prefix macro, as in macrophage, mean?
Is a large or long.
Which of the following prefixes means dead?
It's a neuro, as in neurocosis.
Neuro? Ano sabi? May problema na tayo sa lamin. Ha? Necro. You said neuro.
No, necro, as in necrosis.
The prefix para means?
Alongside of abnormal.
Which of the following prefixes means small or millions?
Is a micro, as in microscope.
What does the prefix neuro, as in neurotransmitter, mean?
Of or pertaining to nerves and the nervous system.
The suffix for a field in medicine is?
Physiologist, as in oncologist.
No, that's a specialty.
A specialty.
A field in medicine. Like psychiatry.
Iatry, as in podiatry.
Okay. The prefix pneumo, as in pneumonia, means?
Is it pertaining to the lungs?
Which of the following prefixes means thousands?
It's a milliliter.
What does the prefix ad, as in adduction, mean?
Up, increase, or on, toward.
The prefix an, as in analgesia, means?
It's a not or without.
The prefix for between or among is?
Inter, or is intercircular ligaments.
Good. What does the prefix air, as in aerobic, mean?
Is air a gas?
Which of the following prefixes means bone?
Os, or osteosis.
The prefix anti, as in antibody, means?
Is against or opposed to.
Prefix for radiation is? Napaka-obvious naman ito.
Radio. Radio.
Okay. What does the suffix phobe, as in photophobia, mean?
That's a fear of or aversion to.
Which of the following prefixes means against?
Is a contra. As in contra indicate.
The prefix X, as in excision, means?
Out of, away from.
The prefix for skin is?
Is a cut.
Kut. Kut, as in subcutaneous.
Subconscious. Sorry.
In cutis, di ba? What does the prefix bi, as in binary, mean?
Is it twice and double?
Which of the following means water?
Dehydrations.
Which the prefix optic, as in opticochemical, means?
Relating to chemical properties of the eye.
The prefix or suffix for sweet is?
Is it gluco or gluconcorticoid?
As in glucocorticoid. What does the, okay, let me say a little bit about glucocorticoid. This is released by the adrenals, especially when you're under stress. That's why bawal ma-stress, tumataas po yung sugar natin.
Opo.
So when you're under a lot of stress, a lot of duress, you worry too much, you keep thinking about your illness, your blood sugar shoots up because you're putting your adrenals into a lot of stress, and it produces the cortex part of the adrenals. We have the medulla and the cortex. You will get to know all of that. Are you excited? Okay, glucocorticoid. Glucocorticoid, ibig sabihin, nanggaling sa cortical part, cortex part of the adrenals. Where are the adrenals located? So,
Antral parts.
have you seen the cap of yung dwarf? Diba? Para siyang cap on top of the what two structures? Kidneys. Now you understand. Bawal na pagod.
Kidney is a part.
Okay?
Sa kidney, doc?
It's on top of the kidneys, the adrenals.
Okay.
Okay? And the adrenals has two areas. You have the cortex and the medulla. The cortex produces glucocorticoid, which raises blood sugar. Okay?
Okay.
What does the prefix cerebral, as in cerebrology, mean?
Is it pertaining to the brain?
Good. The prefix ultra means?
That's beyond or excessive.
Which of the following means blood condition?
Anemia, as in anemia.
Emia or anemia. Okay.
Yeah.
Congratulations, Sir Michael. Thank you for really working hard.
Yeah.
Thank you po.
But thank you for the time. You allow us to learn more.
Of course.
Yeah.
I will have a way of knowing. Ngayon, inuulit-ulit ko, hindi nyo naman nasagot na. Okay.
Hindi ko na nabalikan, Doc, eh. Yung
I hope you will like week 5. I'm sure after this, you're going to open week 5. Or probably some of you have opened them already. Okay? Okay,
yes, Doc.
great. Thank you. Now, let's go to Ma'am Lynn. Ma'am Lynn,
Yes, Doc.
what does the prefix enter, as in enteritis, mean?
Of or pertaining to the intestine.
The prefix for hard is?
Dura, as in dura mater.
Okay. The prefix dors, as in dorsal, means?
Of or pertaining to the back.
Which of the following prefixes means fiber? This is too obvious.
Fiber, as in fibroblast.
What does the prefix hepat, as in hepatology, mean?
Of or pertaining to the liver.
So now you understand why liver cancer is called hepatoma. Okay? Cancer of the liver. Hepatitis. Okay? I hope you're having fun. Which of the following prefixes means within?
Intra, as in intramural.
The prefix vas, as in vasoconstriction, means?
duct or vessel.
So now you understand why it's called cardiovascular. Okay. The prefix for again or backward is,
Re, as in relapse.
okay, talking about relapse. How is it different from the term remission? Let's say you were diagnosed to have cancer, you received chemotherapy. Okay.
Relapse pag umulit po.
Umulit, bumalik,
Pag remission, parang
nagpahinga.
nasa stage siya ng nawawala.
Okay. You will get to
Pag umulit,
come across
relapse.
all these terms. Let's manifest, huh? I'd like to see all of us in the that's the dream of Dr. Palanca, the late Dr. Palanca. Okay. What does the prefix bas, as in basal ganglia, mean?
Base or foundation.
Which of the following prefixes means before?
Pro as in procephalic.
The suffix "copy" as in endoscopy means?
Use of an instrument for viewing.
Okay. Microscope, stethoscope. The suffix for attack or seizure is?
Lepsy as in epilepsy.
What does the suffix "logi" as in hematology mean?
The study of.
Which of the following suffixes means a condition, disease, or increase?
Osis as in psychosis.
The suffix for urine is?
Urea as in polyuria.
What does the prefix "brachii" as in brachium mean?
Of or relating to the arm.
Which of the following suffixes? Okay, actually, this is quite important. You know why? Because when we get to study the vessels, the veins, the arteries, it will be very easy if you know these terms. No, this is actually preparing all of us for next week. Excited? Okay. So start answering the assignment now. Okay. So the answer is
Of or relating to the arm. Brachial.
Yeah.
Tool, condition,
which
or
of the following
disease.
suffixes means a condition or disease?
Ism.
Myo as in myoblast means?
Of or relating to the muscle.
The suffix for formative or pertaining to producing is?
Genic as in cardiogenic.
What does the suffix "phil" as in hemophilia mean?
A condition or a disease.
Phil. Hemophilia, pedophilia, phil.
It's a disease
No.
or a condition.
Tapos
Pertaining
tayo sa disease, ah. Di ba pedophile? Okay.
attraction.
Attraction for feel. Okay.
Okay.
Which of the following prefixes means of or pertaining to the nose?
Rhine as in rhinoplasty.
All as in femoral means?
Pertaining to.
The prefix for heat is?
Therm as in thermogenesis.
What does the prefix lip as in liposuction mean?
Fat.
Which of the following prefixes means different?
Sen.
Yeah, xenograph as in xenograph.
To.
Glyco as in glycolysis means?
Sugar.
The prefix for motion is?
Kines as
Yeah,
in
or
kinesiology.
kinesiology. What does the prefix "site" as in cytokine mean?
Cell.
Which of the following prefixes means fast or irregularly fast?
Tachy as in tachycardia.
Melan as in melanin means?
Black color.
What does the prefix cephal as in cephalic mean?
Of or pertaining to the head.
Which of the following prefixes means pertaining to a man?
Andro as in andrology.
Nephro as in nephrology means?
Of or pertaining to the kidney.
Okay, what about... never mind. Which of the following prefixes means inside or within?
Endo as in endocrinology.
What does the prefix cardi as in cardiology mean?
Of pertaining to the heart.
The prefix for denoting something as straight or correct is?
Ortho as in orthodontist.
What's the difference between a dentist and an orthodontist?
Ay, yung mga
Nag-train. Paano
nag-braces
magkita ng...
to. Alam ko, nag-orthodontist.
Okay, now you know.
Yung straighten yung ngipin.
So you don't go to a regular dentist, but you have to make sure na orthodontist siya, okay? When you want you straighten your teeth. Ocul as in oculist means?
Of or pertaining to the eye.
Which of the following suffixes means surgical repair, reconstruction?
Plasty as in rhinoplasty.
What does the suffix stomy as in colostomy mean?
Creation of an opening.
The suffix for surgical incision is?
Otomy as in tracheotomy.
Infra as in infrahyoid muscles means?
Below.
Which of the following suffixes means a disease or disorder?
Pathy as in sociopathy.
What does the prefix patho as in pathology mean?
It's a disease.
The prefix for outside is?
Exo as in exoskeleton.
Mono as in mononucleosis means?
Single.
Thank you very much, Ma'am Lynn. I hope everybody had fun. Please be familiar with all those word roots, okay? Para it would not be difficult for us to remember the arteries, the veins, okay? So try to always go back and don't mind the number of pages. Thank you so much. Now let's call on those whom I have not called. Ay, wala naman. Oh, okay. Let me see. Ma'am Mary Angeli, good evening. Are you there, Miss Mary Angeli?
Yes, Doc. Good evening po.
Good evening. I'd like you to take care of the Back-Shu points, okay? This is
I'll
actually,
just try po.
yeah, I know you're quite new here, but siguro, sige, I'll help you out. Let's just talk about it. What are the functions of the Back-Shu points? Did you research on this? Back-Shu. Okay, I have to call yung mga ano ha, yung batch 1. Okay, let's call on Ma'am Angel. Good evening, Ma'am Angel.
Good evening po, Doc.
Okay. Anong functions ng Back-Shu? Bakit natin bina-Back-Shu?
So, yung Back-Shu po is to regulate the flow and movement of qi from a region towards the heart. So, ni-use din po yung Back-Shu for the chronic diseases.
Okay. Ano ba ibig sabihin ng shu? Transport, di ba?
Apa.
So, meron tayong kanya-kanyang Back-Shu. Actually, I like Back-Shu points because they assist us in the diagnosis of the diseases of the zang-fu organs, especially pag may tenderness. Or sometimes you would see some colors there, parang may redness, no? And so I always use the probe to actually make sure that I'm hitting the right point, okay? And you were right, Ma'am Angel, sabi mo, it's very good for chronic diseases. Okay, actually the back part is the yang part. The front part is the yin part. So yung back natin, being the yang, is supposed to take care of the chronic illnesses. So chronic is yin. Ganun naman talaga. Pag yang ito, di ba makaramihan ng tao masakit yung likod. So we treat, I find the Back-Shu primarily good for the yin organs. But pwede mo rin i-diagnose yung yang. But I usually, example, pag may issue sa heart, I would always, at saka, based on what you see in the patient, based on your diagnosis, you will always be able to prognosticate, no? And alam mo kung saan yung pain sa likod. Okay? So usually, mga may kidney issues, they will just have to show it. Okay, di ba? Pag masakit yung likod mo, diretso, you're actually pointing to your bladder 23. Okay, so they also treat the zang-fu organs. At saka ang effect nito, diretso. No? You don't have to needle it deeply. And make sure you oblique yung pag-needle mo. I usually do this, especially sa first, to reinforce or tonify the organs. But for issues that are excess, I usually sedate it. So you have to know ano po yung sedating technique, ano yung tinatawag na reinforcing technique. Okay, Ma'am Angel, can you continue?
Yes,
Ano
Doc.
ano itong si Shinshu?
Si Shinsu po siya po yung Back-Shu point of the heart. Bladder 15.
Okay,
Also
can you
yin
tell us the
organ.
location.
The location is 1.5 tune, lateral to do 11 at the level of the lower border of the spinous process of the fifth thoracic vertebra.
Okay, from here you could see na meron tayong, okay, nasaan dito yung si spinous? Ito siya, di ba? Yes. So these are, I'm actually showing to you T5, the fifth thoracic vertebra. So sabi ni Ma'am Angel, it is located 1.5 tsun. Can you tell us how to measure the tsun, Ma'am Angel, for the benefit of those who are batch 1, batch 2? Ano yung basehan natin sa pagkuha ng tsun? Nakamute ka.
Sorry, Doc. Fingers po ng patient. Doon po natin susukatin yung tune.
Okay, can you tell us ano yung 1 tsun? Can you show us? Okay, let's say ikaw yung patient. Nakamute ka na naman.
Okay, sorry, Doc. Sorry, Doc. 1 tune is ito po. Nakikita niyo po.
Okay,
Tapos 1.5 tune, ito po.
okay.
Okay. 3 tune. So, ganito po siya isukat. Pwede rin po na 1 tune ay yung dito. Ito po.
Okay. So, sinabi mo kanina, ang bladder 15 is located 1.5 tsun. So, how many fingers would that be?
Okay. So, 1.5 tune is ito po. Itong fingers po. 2 fingers po. The index and the middle finger po.
Okay. So, first you need to know where the bladder, where the T5 is located. How many bones are there in the thoracic vertebra?
So, 12. 12 po, Doc.
So, nasaan yung gitna?
T5. Yes po, T5.
T6, T5, at taas ng konti. Okay, so this is what you do. We usually use this for people who have, you medyo may konting issues sa heart. No? Sometimes they have chest pain, sometimes they complain of palpitations, or sometimes they're a bit depressed, or medyo namumutla. No? So it's good to have that probe that I was talking about earlier because if this needs to be needled, namumula siya when you press the probe. And mind you, if there is really a heart issue, kasi ganito yan eh, a patient may already have the heart issue, but it may not manifest on 2D echo or the EKG, no? So, ibig sabihin, imbalance pa siya. Okay? So you have to needle that. We'll talk about it later. And hopefully for those, I will try to talk to Dr. Webb to include the needling of the, kasi andun yan eh, para you have to locate, dito po yung spinous process. Okay. So this is from the top view. Okay. Can you see it? This is the vertebral body. So dito tayo titingin. So from there, 1.5 tune, lateral. And so how do we, okay, andito po siya. Kita nyo? Sometimes you go by so you have to locate the scapula. As you can see, this is 1.5 tune. So first you have to locate the spinous process of C7. Okay, where is C7? From there, you count 5 spinous processes to the lower border of the spinous process of T5. Then measure 1.5 tune laterally to locate bladder 15 on the highest point of the paraspinal musculature. Or, nakaupo yung pasyente and then their arms hanging down. Yung spinous process ng kanyang T3 is nasa level of the easily palpable medial end of the scapular spine. Okay? So, but that's T3. Nakaganon siya, nakaganon. Makikita mo kaagad, nasa level po siya ng, you can actually palpate the medial end of this one. What do you call this? This is called the scapula. Okay? So you ask the patient to sit down. Ako kasi pag medyo, I ask the patient, would you like to lie down? Naka-prone, no? Kasi siyempre tutusok mo yung likod or uupo lang siya. So pag nakaupo siya, iganon mo yung kanyang makikita mo, mafe-feel mo yung ito, the medial border of the medial end of the scapular spine. Okay? From there, you count down to spinous processes to locate bladder 15. Okay. Kasama din dito si do 11 sa midline. So this is actually do 11. Okay. So how do you needle this? You don't needle it perpendicularly. You needle it obliquely. Ano lang ha? 0.5 to 1 tune. Huwag masyadong malalim. So if I were you use a short needle. Hindi naman to palaliman, no? Kasi baka mamaya maano mo yung In clinical practice, we often needle this transversely. Okay, what some practitioners do, tinitape nila yan. So, parang nakahiga siya ganon, comfortable. So, naka-sub-Q, ganon. Okay? So, you can secure it with a tape, or we call it micropore. Kasi what will happen if you needle it too deeply? Pwede ka magkaroon ng pneumothorax. That's a term, pneumothorax. Okay? So this is very good for tonifying and nourishing the heart. It can actually regulate your heart chi. So you Google this. And it really helps. Now, in fact, the patient would say, oh, parang may nabunot sa kanyang likod. Okay? Try using that. Pwede nyo pa-practicean kay Sir Michael. I'm sure that area, Sir Michael, are you there? Masakit yan dyan. Okay? Yeah.
Puro stress, Doc eh. Kailangan yan.
Oo. Ganun talaga. Okay. Now let's go to, okay ka pa, Ma'am Angel?
Yes, Doc.
Back-Shu.
So Back-Shu po is a Back-Shu of the liver shu, bladder 18. Location is 1.5 tune lateral to do 8 at the level of the lower border of the spinous process of the 9th thoracic vertebra.
Okay. Always remember, kanina di ba, T5. Ito naman iba, T9. Right? So supposedly T8, but it's T9. Okay, so I would like you to look at, if you ask the patient to do like that, you can actually see this. No? We call this ano ba tawag dito? Basta yung dulo nito, okay, ng scapula. And then, so dito mo siya i-align. Now, why did we take this up? Because this is so common, especially when you are angry all the time. O yung nagkangina, when you're stressed, when you're so emotionally stressed, no? Stressed out. Okay? Or meron kang liver cheese stagnation. So this is very good for the liver. Very common po yan. So nasa T9. Or you divide the thoracic into, okay, ilan-ilan nga yung thoracic, ilang bones? There are 12. So i-divide mo siya, or basta dito, tingnan nyo, oh, nasa dulo siya nito. So that should be lower here. Okay? Anyway, you can always Google this. I always do this for patients who have liver issues. Yung nanilisik ang mata, madaling magalit. So that's actually liver shu. Okay, Dan-shu, Ma'am Angel.
Okay, so number 4, Back-Shu is the Back-Shu of the gallbladder.
Okay.
So bladder 19 po. Location is 1.5 tune lateral to do 7 at the level of the lower border of the spinous process of the 10th thoracic vertebra.
Okay. Why are this called thoracic vertebrae? Ano yung ating basihan? Like, what sets it apart from the lumbar, from the cervical? So pag sinabi mong cervical, nasa may neck. And how many bones are there in the cervical vertebra?
7.
7. Very good. What's the first cervical vertebra?
Atlas.
Yeah. Bakit sa tinawag na atlas? Kasi parang binubuhat na yung you know, atlas?
Skull.
Yeah, the skull. Okay, very good. Okay, so in fact, there are points there that are very significant. Okay, why did we have to take this up? Bladder 19 or Dan-shu, gallbladder shu. Because kung masyado ng stress yung pasyente, remember, the liver is a yin organ. Pag masyado na siyang uminit, it will already affect the gallbladder because gallbladder is more yang than yin. Okay? Especially if the patient will tell you, why do I have like this bitter taste the whole day? Mapait panlasa niya. Okay? Of course, they will not tell you what they are suffering from. It's up for you now to find out in the most subtle way, and don't make it appear that you're a bit parang masyado kang mukha kang marites, no? And try to there are techniques that you have to really learn on your own. First, you have to make sure that the patient likes you. And take note, these people who are having liver issues, gallbladder issues, especially if they have this wood type personality, they are so perfectionists. Okay? Even if alam mo na nag-improve siya, they will not let you know. Especially if they don't like you. Okay? So first, you need to make sure that the patient likes you. Okay? Dapat napapakalma mo siya. Okay, so next, Ma'am Angel, would you like to continue?
Okay, Doc. So number 5 is Back-Shu, bladder 20, Back-Shu of the spleen.
Okay. Yeah,
Yes, po.
thank you. So anong thoracic vertebra po ito?
So thoracic 11 po, Doc.
Yeah, T11. Okay, bladder 20. Now, this is very important because especially for people who have dampness, who have phlegm. And take note, pag matagal na masyadong liver stagnation mo, affected si spleen. So, what I have showed you earlier are what usually the points that you have to needle. Can you connect? Di ba kanina bladder 15 for the heart, then we took up bladder 18, then bladder 19 for the gallbladder, meron din si bladder 20 for the spleen. Okay? Yung mga diabetic, yung mga parating sumasakit yung shoulder because of dampness, because they love cold food, or if they live in Baguio, there's too much dampness, too much cold there, use bladder 20. Okay, bladder 20, Wei-shu. Ma'am Angel.
Wei-shu po, Doc, is bladder 21, Back-Shu point of the stomach, thoracic 12 po siya, Doc.
Okay. So, a very good clue is T12-21. Nagets nyo? O, T12, tapos ano?
Baliktaran.
So bakit siya tinawag na thoracic? Let me go back to my question earlier. Because nakikita nyo, sa ribs siya. Diba? Sa ribs, pertaining to the thorax. Kaya tinawag na thoracic yan. Next, we have bladder 22. Is zang-fu. Okay, can you tell us the location?
Sa ano na siya, Doc? Sa lumbar 1 na po.
Okay, nasa lumbar na tayo po. Why am I so excited to tell you about the zang-fu? Zang-fu kasi is a triple burner. It actually balances all the 3 burners. So usually this is the conduit for the fluids, diba? Like there are people na may konting issues sa lower burner or hindi siya in sync with the upper burner, the middle burner. Okay? Lalo na pag malaki yung tiyan mo, so may konting issue ko with the middle burner, tapos meron ka pang UTI, yung mga ganon. So, bladder 22. Next, another very important point is Shan-Shu. What point is this?
Kidney Back-Shu po, Doc. Bladder 23.
Bladder 23.
So, yes,
Okay.
located po naman siya sa lumbar 2.
So how do we locate this? This is what I do. Do you know this structure? Ay, bakit hindi ko ito magalaw? Ito, kikita niyo yan? Di ba madali lang ipalpate yan? You go at least 2 steps up. Okay? That's your bladder 23. Okay? Waistline. Okay? So first you need to locate. This is called the Taffier's line. Ito. This is the line connecting. This is called the highest point of the iliac crest. Sige, ipalpate yung iliac crest nyo. Okay? So you determine that line which intersects with the spinous process of L4. No? So from there, you count upward to the lower border of the L2. And on this level, you locate bladder 23. Nasa L2 si bladder 23, di ba? Sa L1 si bladder 22. Right? Okay, it's up to you. You can, okay, this is my favorite point. Bladder 23. Next. What is this?
Ano na po, Doc? Large intestine po.
Yan,
Blood Back-Shu of the large intestine. Bladder 25. Location is lumbar 4.
Okay. This is actually good for strengthening the lower back. So malapit na dito po, oh, si bladder 25, Zang-fu. Okay? Large intestine shu. Usually kung may issue sa stomach, masakit din yan. Next is bladder, sige lahat-lahatin mo na, malapit na tayo matapos. Bladder 27.
Bladder 27, Doc, is a Back-Shu of the small intestine located at the S1 or bandang sacrum area po. Sacrum 1.
Okay. Per sacral.
Sacral.
Yeah, ramen. Okay. Pag masyado ng excess yung fire ng heart, mag-spill over yan dyan. Masakit din yan. Kasi this is SI. No? Usually, nagkakaroon sila ng problema sa pag-ihi. No? It actually drains dampness and damp heat. It regulates the water passages. Yung mga umiihi na parating nag-UTI, ibig sabihin grabe na talaga yung heart fire nila. And finally, what is this? Bladder?
Bladder 28 po, Doc. Located naman po siya sa sacrum
Second
2.
sacral.
Opo, second sacral.
Ano to siya? What is this? The Back-Shu of the...
Back-Shu of the urinary bladder po, Doc.
Okay. So, yun.
Very good for
Yeah.
low back pain.
Okay, what we just discussed are the most common points that I found very effective. I'm just sharing it with you. No? What are the points, Sir Darwin? Sir Darwin, ano yung mga points na diniscuss natin? O, di ba nakalimutan na? Sige po. Ay, walang sound.
Bladder 15 po.
Okay.
Back-Shu.
Do you
Bladder
find it like what particular patient do you think may relevance at pinag-uusapan natin? Anong number one killer disease ngayon sa mundo?
Heart
What's the number
disease.
one heart disease? A lot of people just ignore it. I remember one patient, when I checked the tongue, sabi ko sa mga familya niya, be careful ha, about the ganun. Ay, wala naman doon nakita sa 2D echoes, ECG, everything was normal. You know, after 6 months, nasa ICU na siya. And they told me, sabi ko, ganun talaga. So sana, wala ka pang nararamdaman, nagpa-ano na siya, acupuncture. So remember, bladder 15. You will not forget this. Ang maraming issue. And they would often deny it. Of course, when they go to their doctor, negative. But that doesn't mean that you are off the hook. Especially kung may family history ka. No? When you have sleep issues, you can hardly sleep, or you keep waking up in the middle of the night, like you have to pee 5-7 times. It's not normal. Or sometimes you have to, you wake up at 11 p.m. or 1 a.m. That's not normal. Okay? What was the other point, Sir Darwin?
Bladder 18.
Yeah, bladder 18, liver.
Back-Shu, liver.
Yeah. And I always needle it together with bladder 23, especially for elderly, senior citizens. Alam niyo ba, ang kidney pati liver, they help each other. No? They have a mutual understanding. So, remember, we have aspirations in life. We have, sometimes if you don't achieve your goals, you end up, when you feel frustrated, that affects your liver. Or when you are so successful because you work really hard for the money, that also affects your kidney. So magkakaroon ka ng kidney deficiency. So when it develops empty heat, so that will actually affect the liver, right? So I would usually use bladder 18 and bladder 23. Parang prophylactic na yon. Yan, kung ayaw mo, good luck. Baka in 10 years time, nagda-dialysis ka na. So I would like to look at, people, siguro, let's do it like on a monthly, twice a month basis, no? I have one patient, couple sila. They would see me talaga twice a month. They don't mind kasi they feel kasi every day we had to work. Meron kasi silang restaurant business, so they're a bit stressed. And they notice na hindi sa madaling magalit, but nandun pa din yung problem, but now, medyo may mga issues sila nawawala na. So you see, though these are the people that, honestly, people only come for treatment as a last resort. Do you agree? They should come to us while it's early. That's why it is very imperative that we should know how to read the tongue, feel the pulse. Okay? I usually make them feel their pulses. We take pictures of the tongue, and then on their second visit, they would be amazed. Ay, bakit nagbago na yung tongue ko? At the same time, they'll feel good, and they will see that something good is happening. What's the other point, Sir Darwin? So, bladder 15, bladder 18, bladder 23, bladder 20, right? Did we take up bladder 20, bladder 21?
Spleen.
Yeah. So 2021,
19 din daw.
yeah, 19 din. Lalo na pag nag-excess na, naging young na, super young na si liver. Okay? These are for people who are always angry with their life, with everyone. No, that's why they keep saying, ay, matanda na kasi yan. Of course, the more that you would need monthly treatments or twice a month. It's an investment, actually. So it would be best that we know these things para we can help them, right? So I think that's about it. I hope you're not all or baka mayroon na kayong chi deficiency or inaantok na. Any comments, Ma'am Janine? Oh, especially those who
Hindi
live in
naman.
Baguio, you are in forever dampness, coach.
I know. Pero doc can be like, let's say you just do the Back-Shu points every time you see your patient.
Yeah. As a,
So you see,
parang preventive lang siya. Actually, ganito yan, no? We use the Back-Shu for prevention. It's like the effect is directly on the organ, especially if you needle it correctly. And yung front mo is the counterpart. Sa front naman, it's more of the acute, like what the patient is experiencing for the last few weeks or what the patient came to you for. For example, most of the problems, especially pag masyado kang stressed, and they would say, ay, bakit pa na akong yung GERD ko forever na? So don't look at GERD as an issue with the stomach alone. It could be because there is liver qi stagnation. No? Okay. Most of these people have been taking medications already, usually mga ano lang, pang relief lang, and they keep taking it. Like, but again, you need to focus on the liver. And bladder 28, bladder 18 is, ay nako, mafe-fill mo. Yeah, that was a good question. Yeah. So I would, for those who have, I also address the issue or the symptom that they came for. They came for acupuncture for. But do not forget the chronic issue. Yeah.
yeah, true, doc. I have a patient actually. She's 74. She has GERD, but she has hypertension. So I did all the nutrition. I even did castor oil packs and then the right juicing, you know. She came back after a week. Sabi niya, masakit pa rin. Although her stomach, nag-ano na siya. It's not as hard. Yun. So, Doc, baka naman you can teach us more sa auricular para we can do
Oh
it.
yeah, okay. So that would mean I need to. Okay, wait lang. Paano ko ba ito focus? Okay, let's talk about it.
Yeah, we can
sige,
do
sige.
that.
Next week,
Kasi,
I will do. You prefer the auriculotherapy? Okay.
kasi Doc, it's easier for us, di ba? Like we already have our,
True.
we can do it already. Sabi nyo
Okay.
nga, we can't do, I mean, I can do Back-Shu for the family, but I can't do it. So, I mean, if I can do that for my patients, that would be a
Yeah, you can do
great
the
help.
ear because it's not regulated. That's why we're
Yeah.
teaching you. Ay,
Yeah.
naku,
But even the
siguro,
points, Doc, pati yung ano yung packet ba, pababa, you know, which, how?
Okay, sige, let's do it. Do you see this thing here? Just ko think.
Yeah.
Okay. Ito, pati yan. Okay, it's different kasi pag sa ear, no? Okay, you see this area here?
Yes.
So you need, nasaan ba yung probe ko? Conscious tuloy ako. I-ano mo siya. Like this one, we'll have to coincide with this area. You remember this area?
Yes.
And then this one, there's a structure there, the cruise of the helix. So that's
Okay.
Bladder 10 to bladder 30. Yan. So, ibig sabihin, bladder 20 would be in between here. You get it? Ito, there should always be landmarks. You know this one? This is the cruise of the helix. So you extend here, that would be your bladder 10. And this one here, remember where the Shanman is? This one?
Yes. Yes,
Yeah.
Doc.
That area there is bladder 30. So if you're going to locate bladder 20 on the ear, so you're going to go in between, halfway. Okay?
So this whole area is the bladder.
Yeah, the whole area. And the most important ones are between bladder 10 and bladder 30. So makes sense, di ba? So ang gitna niyan will be bladder 20. Do you have the book Precise Atlas of Ear Acupuncture?
No, Doc.
You have
Can
it. You
in
have.
the email?
Sige, I'll send it later. Are you all part of the group chat? I'll send it later.
Sige, Doc. Thank you.
There are meridians of the ear. Now, what I'm excited about is it works. As in. Yeah. And yung mga medyo hindi masyadong magaling. Well, they use that ear chart that's very simple. Don't be so dependent on that. Yung ba, di ba yung mga ear chart, and doon yung heart, yung lungs. You only do that when it's when the organ needs to be tonified. Okay?
Okay.
So what about if the patient is in pain? So sometimes, okay, ano mo yung heart point, ano mo, pero bumabalik. But what we want is something that is, so instead of, or aside from, kasi when you talk about relieving the pain, like, katulad ng patient mo, hypertensive, then merong GERD, no? I would be focusing on the kidney. So I would locate the kidney 7, which is somewhere here. Why? Because you need to tonify the kidney. Or pag walang coating yung tongue niya, I would needle kidney 3 or kidney 6. Kidney 3 is the source point. Alam ko yung iba dyan, medyo gusto nang umuwi. Okay, but anyway, don't worry. Starting next week, I'm very excited. Are you excited? Because the topic is cardiovascular. Ang dami niyo matutulungan just by working on the ear. Since it's not legal, to practice, unless you do it you on your own, on your family. But, if you use the ear, it's more amazing because it works fast. Do you want that? Okay, siguro next time, kaya bilisan yung pagsagot, no? Para mabilis tayo matapos. Ano ba topic? Ayan, next week, the topic is she cleft points. Are you excited? She cleft. Okay? I will also incorporate the bladder points. No? Do you get me? Do you promise to study that? Okay. She cleft points, these are the points where the blood and chi converge. Ibig sabihin, nagkakaroon ng pain. Okay? So, meron tayong she cleft for the lung, she cleft for the... And by the way, maraming questions akong tinanong. I think, if I'm not mistaken, more than 40 or 50 questions for the she cleft. You know why? This is the... yeah, sige. Para may gagawin ako. Promise, I'll show you the ear counterpart. Yes? Oh, I'll give you the ear now. You know what? When I went to the office sa LAMP, when I was there last year, bigla ko nakita din yung ano mismo, yung physical book mismo. Doctora Palanca owns it. I think she's the only one who has it. Because sa Philippines, she's the first one who has really studied the ear. At first, I just wanted to ignore it kasi so pero amazing, as in mabilis. Especially when you feel the pulse, ay grabe. Kaya ngayon pa lang, aralin nyo na yung she cleft ng heart, she cleft ng pericardium, she cleft ng bladder. O, diba? O sige, thank you for staying very late. I would have wanted this to end already, but since you are so enthusiastic to learn, this, magpakita lang talaga kayo ng your role is how to digest everything. Hindi ingesta. Digest means you know how to use them. Do you promise me you memorize the she cleft points? And I'll give you, sige, I'll give the ebook now sa group chat. Okay? It's something that not everybody has. So I don't know what, where this energy is coming from. Because when I went to Baguio, there's something in that coffee that that really stimulated my... Okay, Ma'am Cheryl, do you have any question? Are you happy? Si Ma'am Cheryl is in Bicol, di ba?
Yes,
Legazpi.
I'm
Yeah.
thinking I will fly or take the overnight bus to
Yeah.
Manila for Thursday. But
Um,
I'm teaching ngayon sa nursing,
it's
so
okay. It's okay. We're not forcing you. Ganito lang. Paano ba? How will I say it? We'll try to make it easy for you. And the ear is so amazing. It's just so, to be honest, I'm not so really good at it yet because, my God, there are so many points. So pagbukas yo, when I give the ebook tonight, after we end, we hope to end by 9 o'clock. I'm going to, you have to start looking at the meridians there. You know, it's so amazing talaga. And you know what I want to teach next week? Kaya you have to answer mabilis, maikli. Ilang po? 500 pages ba yun? Wait lang. I cannot remember any.
400 plus lang daw.
Very short. So we have a lot of time to, kasi this is the cream of our ano eh. And I think the patient would appreciate it if you just, you know, do the ear. So ibig sabihin, the she-clef point, you use that for pain. You use that for pain. And by the way, I'd like to invite all of you on Saturday. Please invite friends. It will be a little early, but anyway, it will be recorded. I'd like to share with you the new approaches to shoulder problems. And of course, I'm a bit biased on the ear. So, although, the fewer the points kasi the better, di ba? And you need to know anong klaseng shoulder problem yon. Remember, we're not just there to treat the pain. We're here to actually to treat the cause. Okay? And your patient will love you for it. Okay? So, next week, by the way, ngayong Saturday, it's all about the shoulder. So you need to know already some of the points. Do you promise? It's only Monday. We will meet Wednesday for cardiovascular. We'll meet Wednesday. And sige, I'll give it to you now. Are you excited? Iba siya. Hindi siya katulad ng mga charts na pipitsugin. Okay. So thank you so much for trusting us. Are you happy, Sir Michael? Hindi ka na nagpakita ng mukha mo.
Madilim na dito, Doc eh. Tulog na yung mga borders ko.
Okay. Sige, tapos ganito ha, let's try to finish all the questions in 30 minutes, 40. Kaya dapat para siyang bullet and we focus more on the points. Okay? And I'll show both the body points as well as the ear. Ay, nako. The diagnosis. And also, I'd like you to learn already how to feel the pulse. We can do it off air. Kaya pumasok na kayo ng maaga, okay? So that we can do a little of the, it's so amazing, really, no? I have discovered a very simple way to actually, do pulse analysis, pulse reading. And it's so amazing. Sa ear, wala pang 1 minute, nagbabago yung pulso. So ibig sabihin, you know what I mean? So if your diagnosis was correct, you would really see an immediate change in the pulse. And the patient would love it. Yes. Okay. So it's already 9 o'clock. And thank you everyone I hope you're having fun. Congratulations. Umabot kayo ng week 5. And please start studying. Okay? Ma'am Cheryl, thank you. Sir Elvis,
po,
oh my God, Sir Elvis, hindi ako marunong ng sign language. My God, what happened to your audio? Ma'am Janine, thank you so much. I hope you can lead the way there in Baguio. I know you're very good. You want to help people. And paramihin natin yung ating uri dyan. Okay?
Yes, Doc. Baka next year gawa tayo na wellness conference dito.
Yeah, it should be a conference where everybody knows what we're talking about. Okay? That's why it is now, I am giving you the task of really educating them. I'd like you to start teaching people because it's through teaching where you get to also master things. No? Paulit-ulit lang yan. Shoulder pain, low back pain, tapos, ano ba? Yun lang, paulit-ulit lang. Insomnia. And usually the insomnia is due to something else. Okay? Okay, any other question? Si Sir June. Parang nag-aaral na yata si Sir June para next. O sige na. Okay. Kasi baka makalimutan ko pa ipadala. We have to end this so that I can send you the ebook, okay? Bye.
Good night,
Thank
Doc.
you, Doc.
Good
Thank you,
night.
Doc.
night.
Salamat po.
Thank you. See you on Wednesday. Wednesday na po tayo. Congratulations to all and thank you for showing your interest by studying.
Thank you po.
Sige.
Thank you
Maraming
po.
salamat, Doc.
Maraming salamat po. Bye-bye. Good night.
Bye-bye.
Good night.
See you.